Hello, welcome to Boston Bone and Joint Institute. If you're watching this video, you may have a few questions about your VersaROM Hip Brace. This is the VersaROM Hip Brace by Donjoy. Boston Bone and Joint Institute bills this durable medical equipment item to your insurance company. Please contact your insurance company for your benefits, or contact our office for additional information. The purpose of this brace is to restrict your range of motion after surgery. Some common surgical procedures include hip arthroscopic labor repair, gluteus medius repair, and proximal hamstring repair. Restriction of hip motion will allow for soft tissue healing in order to give you the best surgical outcome. This brace is also a reminder of the motions you should be avoiding following surgery, most commonly flexion, extension, and abduction. This brace should be worn at all times when ambulating with crutches. You may remove the brace for bathing and dressing. Your provider will discuss with you whether or not you need to sleep in the brace, as well as other times you may remove it. Please refer to your postoperative protocol for the length of use and any additional restrictions. While you're wearing this brace, you are advised not to drive. Prior to your surgery, you'll be properly fitted for your brace. The VersaROM Hip Brace is a one-size-fits-all, but needs to be tailored to your body to make a more customized fit. Once we have fit and adjusted it correctly, you should not need to further adjust the brace. To apply, first place your right hand in the pocket located on the waist belt. Reach around with your left arm and grasp the other side of the waist belt. Place the belt around your waist about 1 to 2 inches above the widest part of your hips. It should sit just above the lower part of your back. This is about belly button level. Next, place your left hand against your abdomen and lay your right hand over top. Gently press to secure the Velcro. It's important that the brace is snug enough that it will not shift, but not too snug that you feel uncomfortable or find it difficult to breathe. Here you will notice the frame of the brace will be aligned down the center, lateral, or outside portion of your operative leg. Please be cautious of the buttons on the frame as they adjust the angle of the brace at different pivot points. This will be adjusted for you during the time of your fitting. You should not need to change them. To secure the frame in place, reach down and grasp the strap. Move the strap around the inside of your lower thigh. To secure, thread the Velcro part of the strap through and around the plastic clip. Gently press to secure this in place. Please be sure not to undo the inside and outside Velcro flap, as it is possible to lose the plastic clip between them. Lastly, there are 2 pull tabs on the waist belt that further secure it. Pull the tabs off of the waist belt and out to the side. This will slightly tighten the belt. Lastly, place the tabs on the belt to securely fasten. To remove the brace, first, move the tabs out from the front of the waist belt and attach to the sides. Please be sure to securely fasten them to the belt. Otherwise, when you reapply the brace, the cords will dangle and twist, making the reapplication process more difficult. Next, unfasten the lower thigh strap. Again, please be sure not to unfasten both Velcro flaps, as you may lose the plastic piece between them. Lastly, place your right hand in the pocket on the waist belt and gently lift off to separate the Velcro from the other end of the belt. For proximal hamstring repairs, your brace is locked at 0 degrees. Please be aware that the hinge does slightly shift forward and backward. This brace will not completely stop you from all movement. This is a reminder not to engage in hip flexion, extension, and abduction. For hip arthroscopic procedures, your brace is set to allow for range of motion between 0 and 70 degrees. Your provider will allow you to reach up to 90 degrees of range of motion, and this setting will control the extra motion that the brace does not fully prevent. The goal is to remind you to avoid flexing the hip past 90 degrees or engaging in abduction. Your provider will discuss the length of time you will be wearing the brace. Generally, this is between 3 to 6 weeks, depending on your specific surgical procedure. All parts of the brace may be cleaned with mild soap on a damp cloth, and should be left to air dry. The straps around the waist and thigh may be removed and hand washed. However, we do not recommend removing them as it may be difficult to reposition. If you have additional questions regarding your VersaROM hip brace, please refer to your postoperative protocol, discuss with your physical therapist, or contact our office by phone or message through the BBJI portal to speak to a certified athletic trainer.